Penicillin. Can I have seizures if I'm given this medication? What is it and what is it used for? Did you know that previously, more than 1 in 3 people who suffered from a serious infection died due to lack of treatment? Well, penicillin came along and revolutionized medicine, turning these once lethal infections into treatable ones. Today we'll discuss the contraindications for administering penicillin, the differences between penicillin G and penicillin B, its interactions within the body, the routes of administration, and its available forms. Are there any side effects when I'm given penicillin? What diseases does this drug help fight? We'll also mention if there are any interactions with other medications when penicillin is administered. So stay until the end of the video and find out all this. We are the Sibtage Project. Let's begin. Let's start by defining what penicillin is. It's a natural antibiotic. It fights bacteria by inhibiting the synthesis of their own DNA. The cell wall is essential for bacteria to survive in our bodies. Penicillin acts as a bactericide. What is the use of penicillin? It helps us treat various bacterial infections, both common and serious. It's important to note that penicillin is not indicated for viral infections. What diseases does it help with? For example, penicillin helps prevent complications of pharyngitis, such as rheumatic fever. It is also indicated for bacterial pneumonia, syphilis, otitis media, and skin infections like shingles and cellulitis. Urinary tract infections are also treated, as penicillin is a drug used to treat these types of illnesses. How does it work in the body? Penicillin destroys the bacterial cell wall. This causes the bacteria to rupture and die. That's why this process is effective. It prevents the bacteria from replicating in our bodies and causing potentially fatal negative effects. Now let's discuss the difference between penicillin G, nenitin, or ordium, and penicillin B. Penicillin G is a more potent type of penicillin used to treat more serious infections. Its main characteristic is its rapid action. In contrast, penicillin B is more stable in gastric acid and is suitable for oral administration. It generally has a shorter duration of action, so it is typically taken 3 times a day. Always under medical supervision. What are the routes of administration for penicillin? Well, it all depends on the type and severity of the infection the person will have. When someone goes to a doctor, the first thing that should be done is a thorough evaluation to determine the appropriate treatment. Penicillin B comes in oral form, such as tablets, capsules, or liquid suspension. Penicillin G is also available intramuscularly, meaning by injection. This is generally used to treat long-term infections. Finally, there's intravenous administration, which is also recommended and used for more serious infections. So, how does the form or use of these presentations vary? It all depends on the type of infection the person has. All of this is done under strict medical supervision. Is there a recommended or standardized dosage for penicillin? I recommend that you always consult a doctor for a thorough evaluation to determine the type and severity of the infection. The person's age and weight are crucial factors in advising on the use of this medication. Never self-medicate, as this can have serious consequences. It can cause side effects, and it also has indications and contraindications, because this drug must be strictly monitored by your primary care physician. What are the correct indications for the use of penicillin G, also known as Benitin, in newborns, children, and adolescents? Well, it is used to treat conditions such as pharyngotonsillitis, since it is caused directly by a very specific bacterium, as well as primary and secondary syphilis and erysipelas, which is a superficial skin infection caused by bacteria. Note that this drug is not used against viral infections. Pay close attention to this point, and we will also mention the indications for procaine penicillin G, since it is recommended for respiratory infections, urinary tract infections, and others that directly affect the ear, nose, and larynx. It is also used against dental infections. Are there any side effects if I am administered or take penicillin? The answer is yes. First, let me tell you that every organism, everyone, is different. You can experience side effects just like other people, right? Let's start by mentioning the most common side effects. When penicillin is administered, a person may have an allergic reaction. What does this mean? It means that skin rashes or hives may appear, and the person may start to feel itchy and scratch. This is common when it is administered directly by injection. Other side effects can also occur, such as gastrointestinal disorders. This refers to nausea, vomiting, diarrhea, or digestive discomfort. Pain or swelling at the injection site may also occur. There are also other disorders that are less common but can occur, such as hematological disorders, which means that the person may develop anemia or neutropenia, which is a decrease in cells called neutrophils. There are also nervous system disorders, such that the person may begin to experience tonic-clonic seizures may occur. Drowsiness, stupor, and coma are possible side effects, though rare. To avoid these, it's essential to determine if the person is allergic to this drug and choose alternative medications. What are the contraindications for penicillin use? For whom is it contraindicated? People with a penicillin allergy should not use this medication, as it can cause a severe reaction called anaphylaxis. What is anaphylaxis? It's a severe, potentially life-threatening allergic reaction. Penicillin should be avoided in these patients. Hypersensitivity to any component of penicillin is also a contraindication, and its use should not be recommended in these patients. Extreme caution is necessary in individuals with a history of conditions such as asthma, severe allergies, and kidney failure, as these conditions can trigger adverse reactions. You may need to adjust your penicillin dosage, and only your doctor can do so. It's very important to note that the misuse or overuse of penicillin can lead to bacterial resistance, making antibiotics ineffective the next time you have an infection. That's why self-medication is never recommended. You might be wondering, what is bacterial resistance? Well, it's the ability bacteria develop or adapt to survive and multiply in the body due to the misuse of antibiotics. This happens mainly when antibiotics are used incorrectly, in inappropriate doses, for insufficient time, or unnecessarily. For example, many people use this drug to treat viruses, and we mentioned in a previous section of the video that it's ineffective against viruses. As a result, bacteria learn to defend themselves against the medication, becoming stronger and harder to eliminate. This situation poses a major threat to global health since common infections could become incurable and even fatal. Routine medical procedures would become riskier. Be very careful with your antibiotic use. As we've mentioned in other videos, the entire game team recommends caution with any other medication. Are there any interactions between penicillin and other drugs? The answer is yes. People using oral anticoagulants risk an increased anticoagulant effect. People taking methotrexate with penicillin will experience increased concentrations of methotrexate. It's necessary to monitor the degree of this increase. Children who have received the BC vaccine with penicillin will experience a decrease in the vaccine's therapeutic effect. Avoid using them simultaneously. It's very important to consider this information to prevent any negative effects. Taking all of this into account, we can conclude that penicillin is one of the most important and effective antibiotics in the world. It is used to treat a wide range of conditions. Bacterial infections. However, it's crucial to remember that it should be used under the supervision of a healthcare professional, as its improper use can contribute to the aforementioned bacterial resistance. I hope you enjoyed this video. If so, please subscribe and like it. We're ready to bring you other important and relevant medical topics. My name is Taj. We are the SibTaj Project. Thank you very much.